After a traumatic experience, it is normal for one to feel frightened or sad or don't know what to feel for that matter. But sometimes people just can't get over those feelings, and over time they just progress and get more painful and keep getting worse. If that is the case, one person might be suffering from PTSD or post-traumatic stress disorder. If anyone is at risk for PTSD, so that's why I will be informing you today about the causes, signs, and symptoms, and the treatments of PTSD. What is PTSD, you may ask? It's when one's fight or flight response is changed or damaged. So as a result, a person who has PTSD will feel stressed or frightened even when they're not in any immediate danger or no longer in their harmful situation. This disorder can happen to anyone, but it's especially common in war veterans. Now moving on to the causes of PTSD. Since this disorder is becoming more and more common, many scientists today are focusing on genes that take part in creating fear memories. And these genes produce two important things that aid in forming fear memories: Stathmin and GRP, or short for gastrin-releasing peptide. Stathmin is a protein needed to form fear memories. This is what causes us to freeze when we are in danger. Now GRP. GRP is a signaling chemical in the brain that is released during tragic events in one's life. In most individuals, GRP helps control the fear response. But how do these things cause PTSD? Well, a shortage in Stathmin and GRP can lead to the creation of more significant and longer lasting fear memories. So they just keep experiencing the memory over and over. These scientists have also discovered another gene called 5-HTTLPR that produces a chemical that controls fear and mood called serotonin. So a person with PTSD will have this gene altered. The next causes of PTSD will probably be more familiar to you. Environmental factors such as trauma and head injury can lead to this disorder. Trauma can be abuse as a child or neglect, accidents such as car accidents, natural disasters, war, fires, or the loss of a loved one. Some other causes can be personality, cognitive, and social factors. Some examples of these can be looking at things or challenges in a negative way or choosing not to use social support. All these things can greatly influence the causes of PTSD. Next, I will talk about the signs and symptoms. There are three main symptoms of post-traumatic stress disorder. The first one is re-experiencing. This symptom includes flashbacks or reliving the trauma, bad dreams, and frightening thoughts. All of these reoccurring for an extended amount of time and accompanied with physical symptoms such as sweating or a rapid heart rate. The next symptom is avoidance. Many things fall under this symptom, such as staying away from people, places, or objects, feeling emotionally numb, guilt, depression, worry, losing interest, and trouble remembering. The last symptom is hyperarousal. This can be defined as easily startled, high tension, and difficulty sleeping, often accompanied with angry outbursts. These symptoms may cause a person to change their daily routine and way of life, such as how they eat, get dressed, or what time they may wake up in the morning. For my last point, I will talk about the diagnosis and treatment for PTSD. For one to be diagnosed with this disorder, they have to show 1 re-experiencing symptom, 3 avoidance symptoms, or 2 hyperarousal symptoms for at least 1 month. There are 2 main therapies one can do for post-traumatic stress disorder, those being psychotherapy and cognitive behavioral therapy. Psychotherapy is commonly known as talk therapy simply because you are speaking with a mental health professional. This can either be a group session or one-on-one session. Cognitive behavioral therapy is a type of therapy that has 3 main parts: exposure therapy, cognitive restructuring, and stress inoculation. These things can help people face and control their fears as well as making sense of their bad memories. As you can see, PTSD is more than just a fear. It's something that can tear a person apart, as it just keeps resurfacing and they keep living the trauma over and over. From a neglected child to a retired war hero, it can happen to almost anyone. So look for the signs and symptoms and help a person today.